pharmohub.pk.
Naproxen. Drug class.
Insights:
Dosage forms.
tablets, capsules, gel.
Clinical uses and dose.
As analgesic 500 mg initially, then 250 mg every 6 to 8 hours. Also for rheumatoid arthritis, 500 to 1000 mg every 12 hours.
Adverse effects:
Nausea, abdominal pain, drowsiness, headache.
Precautions:
Use with caution in congestive heart failure, hypertension, renal, and liver impairment. Elder patients are at greater risk of G1 events.
Brands:
Naproxen, Synfex, Naproxen.
Sodium alginate. Class.
Reflux suppressant, antacid.
Dosage forms and strength.
Liquid 500 mg into 10 ml. Liquid advanced 1000 mg into 10 ml. 500 mg.
Clinical uses:
Heartburn, reflux, esophagitis, hiatus, hernia, dyspepsia due to reflux.
Adverse effects:
Very rare anaphylactic reactions and bronchospasms.
Precautions:
Contraindicated in patients with known or suspected hypersensitivity. The product is considered high in sodium. This should be particularly taken into account for those on a low-salt diet. For example, in some cases of congestive heart failure and renal impairment.
Brands:
Gaviscon, Gastocid, Cascade.
Indapamide. Drug class.
Anti-hypersensitivity diuretics. Thiazide diuretics.
Dosage form.
Tablets.
Clinical uses:
High blood pressure, edema.
Adverse effects:
Dizziness, hyperglycemia, increased urination, electrolyte imbalance.
Precautions:
In patients with gout, diabetes, dyslipidemia.
Brands:
Peplo, Hypamide, Luzol, Natrelix.
Oxetacaine. Drug class.
Local anesthetics and sites.
Dosage form and strength.
Suspension 10 mg into 5 ml.
Clinical uses:
Gastritis, esophagitis, hiatus hernia, heartburn and peptic ulcer.
Adverse effects:
Anorexia, constipation, dry mouth, diarrhea.
Precautions:
Caution should be exercised in patients with history of kidney impairment.
Brands:
Mucaine, Eucaine, Ducaine, or Cane.
Diclofenac Sodium. Drug class.
NSAIDs.
Dosage forms.
Tablet, injections, gel.
Dose.
Usual dose is 50 mg every 8 hours or 75 mg every 12 hours.
Clinical uses:
Antipyretic, analgesic, anti-inflammatory.
Adverse effects:
Abdominal cramps, dizziness, headache.
Precautions:
Caution should be exercised in patients with bronchospasm, cardiac disease, hypertension, renal impairment.
Brands:
Dicloran, Diclofenac, Voltral, Algir. For any queries, join us on our social media sites.